Hello, welcome to Root Nursing. Today we are going to discuss about respiratory system. In that we have normal breath sound, bronchial sound. It is heard when air is passing through trachea and bronchi. Vesicular sound is heard when air is passing through bronchioles. Vesicular it is in the alveoli. So there are two conditions in COPD, emphysema and chronic bronchitis. Chronic bronchitis is the cough minimum 3 months in continuous years. Then emphysema is the abnormal permanent enlargement of air spaces in the alveoli. Once again, chronic bronchitis, it is the cough more than 3 months. Emphysema is the abnormal enlargement of the air spaces. Abnormal breath sounds means stridor, wheezing and crackle. Stridor in a completely obstructed airway, wheezing in a partially obstructed airway, crackle when there is air passing through fluid-filled alveoli. It is commonly seen in pulmonary edema. So crackle, pulmonary edema, wheezing in asthma, stridor completely obstructed pathway. We have to intubate the patient. So the clinical manifestation are dyspnea, hypoxia, tachypnea, wheezing, cyanosis, barrel chest, koilonychia. Spoon-shaped nail is called as koilonychia. Then barrel chest, undropped anterior posterior diameter of the chest increasing. This is due to emphysema. Emphysema means it is the enlargement of air spaces in the alveoli. Dyspnea means difficulty breath, the increased work of breath. Tachypnea, increased respiratory rate. These are the clinical manifestation. Cyanosis means the patient may have bluish discoloration over the body due to lack of oxygenation. Maybe there is decreased oxygen saturation to the patient. So then another clinical manifestation of emphysema is called pink puffers. The patient is called pink puffers, and chronic bronchitis it is called blue blotters. Emphysema, the patients are called as pink puffers. Then bronchitis, it is called blue blotters. Then what is the management? Low concentrated O2, semi-Fowler's position, bronchodilators. The main bronchodilator side effect is tachycardia. So you have to check pulse rate while you are the patient on his bronchodilators. Then steroids have to be given to the patient. Then if you're giving rotacaps to the patient, advise the patient to do oral gargles to prevent oral candidiasis. Then there are patient teaching for the COPD, early detection and treatment of respiratory infection, increased fluid intake, influenza vaccine, pneumococcal vaccine. It is used for the old age. Provide a high calorie and high protein diet. Then you have to advise the patient pursue lip breathing technique to eliminate excessive carbon dioxide. The child may develop tripod position. It may sign of laryngeal edema. So if the child is exposing or showing the position of a tripod, this means is having a sign of laryngeal edema. Then early detection and treatment of respiratory infection. Once again, increase fluid intake. Then vaccination is contraindicated in individual with egg allergy. It is contraindicated in infants below 6 months. It is a yearly vaccination, and it is a old age vaccination. Pneumococcal vaccine is an old age vaccination. So vaccine is contraindicated in patients with egg allergy. Next, I am going to a different topic, that is tuberculosis. The causative agent is Mycobacterium tuberculosis. It is a droplet airborne infection. It is an acid-fast bacilli. Then breathing sound is popping sound. It is spread in the overcrowded area, that is tuberculosis. Acid-fast bacilli is also known as Mycobacterium bacilli tuberculosis. Then the patient may have different clinical manifestation. So there are extrapulmonary TB and pulmonary tuberculosis. The main characteristic is productive cough more than 2 months. Then hemoptysis, coughing up the blood, that is hemoptysis. Then manduxus is a diagnostic spread. That is very important. 0.1 ml ppd purified protein derivative is injected to the left arm intradermally. After 40 to 48 to 72 hours, you have to check the induration. If AIDS patient 5 is positive, then if the induration is more than 5 it is positive for TB. For diabetes patient, it is 10 or more. Normal patient 50 or more. Then you won't say patient is positive with the Mandu's test. It's always positive with the Mandu's test. Then anti-tubercular drugs main important is side effect. Hepatotoxicity is the side effect of anti-tubercular drugs. Some drugs are isoniazid. It is hepatic toxicity and also it causes peripheral neuropathy. So isoniazid causes peripheral neuropathy and hepatic toxicity. Rifampicin, the main is orange colored urine. The urine become orange, that is known as orange colored urine. Pyrazinamide, it is hepatotoxic drug. So whenever you give the anti-tubercular drugs, you have to check the liver function of the patient during after anti-tuberculin drug treatment. It's very important. Orange color urine for the rifampicin side effect, isoniazid, hepatotoxicity, and peripheral neuropathy. Isoniazid is the drug of peripheral neuropathy. Sorry, it is a side effect is peripheral neuropathy. The peripheral neuropathy is caused by the isoniazid. Then pyrazinamide, it causes hepatotoxicity. Then rifampicin, it causes orange color body fluid urine. Orange colored body fluid urine. This is very important. Anti-tubercular drug major side effect is hepatotoxicity, and some drug cause some other disease, that is hepatotoxicity, peripheral neuropathy, orange colored urine, hepatotoxicity. Then you have to check the liver function of the patient before and after administration of the anti-tuberculin drug. Once again, anti-tuberculin drug, the side effect is hepatotoxicity. Drug isoniazid, it is hepatotoxicity and it causes peripheral neuropathy, rifampicin, etc. Then pyrazinamide,